am Dr. Mrinal Kanti Das. I am presently the President of Asian Heart Society. We are having a joint session of Asian Heart Society as well as Heart Failure Association of India on heart failure itself. And I am really happy that the organizers have done excellent job in carrying forward the concept of heart failure, therapeutic measures, and various other things that are very much associated with heart failure. Now, the main topic is heart failure, and as you know that heart failure is a disease or syndrome where there are few symptoms like shortness of breath and all. Along with that, when we put the few parameters like ejection fraction, when it is low, we call it heart failure with reduced ejection fraction, or when it is between 40 to 50, we call it heart failure with mid-range ejection fraction, and when it is more than 50, we call it heart failure with preserved ejection fraction. So that echocardiography has got another facet, and along with that, when the NT-proBNP is taken into consideration, then the whole setup, that is symptom and signs, then echocardiography, and lastly the NT-proBNP values are coalesced together to give you the correct diagnosis of heart failure. Now, once you diagnose heart failure, then you have the job to take care of the illness. Reason? Because heart failure is having a sort of mortality which is more than even the cancer. Many people are hyping the cancer. I am not underhyping cancer, but heart failure is having more chance of mortality, and there can be acute heart failure, there can be chronic heart failure, acute decompensated heart failure, and all these have got very high mortality. That is why we must take care of heart failure, and the therapies that are now very much in vogue are 4 foundational therapies. That is, number 1 is ARNI, number 2 is SGLT2 inhibitor, number 3 is MRA antagonist, and then 4th drug is the beta blocker. Now, these 4 foundational therapies have reduced the heart failure mortality rate by about 50 to 60%. So that's a great achievement. But apart from this, there are other drugs beyond these 4, like vericiguat, then isosorbide dinitrate combination, ivabradine, and other agents like omecamtiv. These are also coming forward, and they are being put in the guideline directed medical therapy. And when they fail, then only we go for device therapy like ICD, CRT-D or CRT, then assist devices, mainly the left ventricular assist device, and lastly, of course, when all fail, then we go for heart transplant.